We are not immune to what's going on in the world today. We are not immune to the recession. We know there have been layoffs at Evraz and in the potash sector. We know there are forces that are having an impact on our economy, but the truth is, and the last job numbers reported confirmed it, the truth is we are still creating jobs. We are the only province in the Dominion of Canada that is still creating jobs. Ladies and gentlemen, we're in the middle of a... Yeah, you can clap for that. We are right in the middle, ladies and gentlemen, of a bash-your-teeth-in recession, and Saskatchewan is in the middle of the ring, and we are swinging more than we are ducking. And that's happened in just 2 years. That new Saskatchewan attitude, I think, has happened over the last couple of years. The best anecdote, the best story that I can convey to you of that attitude, that underscores, that highlights that new Saskatchewan attitude, is from a focus test. We're a political party, and so we focus test. We test two specific groups. We test those who held their nose and voted for us the first time and hope they didn't make a mistake. We test that group. And then we test those who have never voted for us before but indicate that they might take a chance and vote for us in the future. And in the course of those focus tests, a lady was discussing this new Saskatchewan. A Saskatchewan woman from this city was talking about her experience, and she said, you know, for a very long time when I'd talk about Saskatchewan, even with friends who had moved away but were from here, and certainly with those who had never lived in the province, they would say this. They would say, why are you still there? And then she said, do you know what I like about the new Saskatchewan? They don't ask me that anymore. They don't ask me that anymore. Ladies and gentlemen, there are a number of editorials I could point to, a number of articles, a number of reports about our economy, about all of you and what you've achieved, and it's a source of pride for all of us, but nothing motivates me as much as that woman and what she said, that we would all be able to say, they don't ask us that anymore. Consider those who may have, maybe it's some of us, frankly, consider those that used to make some Saskatchewan jokes. You can tell them because they say Saskatchewan. Consider that just a few months ago they opened up Fortune magazine maybe, or maybe they clicked on CNN.com and they came face to face with a new reality that an economic powerhouse on the continent was Saskatchewan. That this beacon of hope that we live in today, shining through the gray malaise of recession, is indeed the province of Saskatchewan, leading not just the country, but the continent. And so the question isn't, what are you still doing there? The question for those people is, why aren't you here yet? We've come a long way in just 2 years. But GPSs are not just about where you've been and where you are now. They're about the future and they're about the destination. So if you will, I wonder if you'd join me in a bit of an examination, a GPS examination on a number of key priorities for our province going forward before I'm done this evening. Let's consider health care. We came from a place, as many provinces did, that was marked by long wait lists, long wait times for health procedures. We came from a place where there was a significant challenge with respect to personnel issues in healthcare, the need to recruit and retain, the need to keep our healthcare practitioners and also to attract new ones to the province. And we came from a place where there was an unease about the balance between administration in the healthcare system and actual frontline delivery of healthcare. Quite candidly and transparently, I'm here to tell you tonight that we're making some progress. That's where we are today. But there are challenges that remain. I'm proud of the government's partnership with the Saskatchewan Union of Nurses. I'm proud of the efforts with respect to recruiting nurses from the Philippines and other parts of the world. I'm proud of our government's doctor recruitment and retention plan and the training seats we funded for doctors at the University of Saskatchewan. I'm happy that we're proceeding with the Patient First Review led by Tony Dagnoni so we can take a unique look at healthcare from the perspective not of a blue ribbon panel looking down, but from the perspective of patients. I'm proud of the fact that because of the prosperity of the province, we were able to stop talking about a children's hospital and start building a children's hospital in Saskatchewan. You know what your mayor said about this? Your mayor was asked, Mayor Pat was asked about this project. Words question to the effect, what do you think about the fact that the largest capital project in the budget, the one that's getting the most attention, is the Children's Hospital in Saskatoon, a Saskatoon project? And your mayor said, it's not a Saskatoon project. That's a Saskatchewan project. Maybe that's why Regina's been on a bit of a roll lately, because you've benefited from that kind of leadership. And I think maybe Mayor Pat was also thinking, when those kids are recovered, when they're feeling better, when they're out of that children's hospital, they're going to want to go see a sporting event or a concert in a provincial stadium somewhere. We've been able to increase funding to the Cancer Agency and add a number of drugs to the formulary, but I want to tell you very honestly, ladies and gentlemen, that wait times are too long in Saskatchewan still. I want to tell you that we know that our challenge is in long-term care. We don't have the capacity. We know there are wait times. We know there are stresses. So these are the priorities of our government moving forward. This is the destination for us, the next challenge for us on that GPS. What about making life affordable in the province of Saskatchewan? You know, frankly, we have come from a place where this has not been a big issue for Saskatchewan. I guess it's always important, but less so than it is now, because in years past we have not experienced the robust growth in the economy that we're seeing now. And so the affordability pressures simply haven't been there as they are today. But they are here right now. One of the pressure points of growth is the affordability issue, especially for those who are most vulnerable among us. This is much more a current challenge, and where we are today is right in the middle of trying to deal with it. Ladies and gentlemen, if you came to speeches of mine in the past, you probably heard me say that should we ever be the government of Saskatchewan, we wouldn't seek growth for growth's sake. We would seek growth because we know what it pays for, the tithe that it brings, the charity it provides, the programs that it funds, the quality of life that it can assure. And I stand on that today because we're dealing with affordability issues in the province because of what that growth has paid for. It's paid for $700 million in tax cuts in 18 months between property and income. It's paid for the fact that 80,000 people have been dropped from the income tax rolls, low